When it's after hours and we are sick and suffering from a minor injury, most of us think about visiting an emergency room. However, did you know that most minor injuries and illnesses can be treated in urgent care? Here today to talk to us about services available at Baptist Urgent Care 9 Mile Road is Dr. Donald Herip with Baptist Medical Group. Good morning, Dr. Herip. Thank you so much for joining us again.
Good morning. Thanks for the invitation.
Second round here with Coming of Age. Pretty exciting. I'm sure you're just thrilled to be back.
I am. I'm very thrilled to be back.
But we're here to talk about a different topic, and before that, I do kind of want to tell our viewers again what exactly you do, what your role is.
My role is the medical director of the Urgent Care and Occupational Health Clinic over at the Baptist Medical Park on 9 Mile Road.
Great. Well, you spoke about urgent care, but for folks that maybe don't know what urgent care is, tell us what is urgent care.
Well, urgent care is sort of a intermediary between the primary care doctor and the emergency room. We always encourage patients to seek their care first from their primary care doctor. The primary care doctor knows their history, their medications, past illnesses and surgeries, etc. But if they can't get in to the primary care doctor, they need a outlet after hours, on weekends, or sometimes they can't get a same-day appointment. Mm-hmm. And when people are sick, they may not want to wait 1, 2, 3, or 4 days to get into their primary care doctor. So urgent care is a level of care below the emergency department that can handle most minor injuries and illnesses.
Well, and I would like to say that personally, I have taken advantage of urgent care, and it has made a significant difference in my life because I remember I had a severe sinus infection, and another time I had a back problem, and I didn't have a primary care doctor, and I was able to just go to urgent care and get that taken care of. So I know what a difference it makes, because otherwise I would have been miserable trying to get in with a primary care doctor.
Right.
So
we realize that, and that's why we're open.
Yeah.
You know, the hours that the primary care doctor is not open.
Right.
And it would save the patients waiting in the emergency room, et cetera, for these minor illnesses and injuries, to get them seen and treated the same day that they are concerned about it.
Right. Well, you spoke of minor injuries and illnesses, but let's kind of tell the difference between someone who would go to an urgent care and someone who really just needs to go to the emergency room.
Okay, well, we can start with urgent care first.
Sure.
Like you said, you had a minor respiratory infection. That's the most common thing that we see in urgent care. Cough, colds, flu, sore throat, bronchitis, sinusitis, etc. We treat all those in the urgent care. Other common illnesses and injuries we see are sprains and strains. People come in with the back strain, shoulder strain. They were playing sports and they sprained their ankle. We can take care of all those types of strains and sprains in the urgent care clinic. We have access to all the normal x-rays that we would need to treat that patient. We have access to the laboratory test where we can draw your blood and perform basic laboratory tests in the urgent care. So we got the respiratory infections, strains and sprains, a lot of skin conditions, skin rashes, burns, abrasions, cuts, puncture wounds, dog bites, cat bites. We take care of all that in urgent care. And other common illnesses, bladder infections, maybe eye infection like pink eye. So any of the typical things that don't require emergent care, we can handle in the urgent care center.
That's really good to know. What about emergency? When do you need to know, okay, it's time to go to the emergency room?
I'm so happy you asked that question.
Because there's probably a pretty significant difference.
There is a significant difference. Now, in the emergency room, they are staffed to handle true medical and surgical emergencies. Say, for instance, somebody experiences chest pain. That may be an indication of they're having a heart attack. That person needs to dial 911, or if they're en route to the urgent care center, go directly to the emergency room. Those people need very rapid diagnostic testing. They need rapid therapeutic intervention. A heart attack is basically where the heart muscle is dying, so they need to get to the emergency room quick to have that diagnosed and treated. So that's one typical example of why they need to go to the emergency room. There's several other examples that I think are very important. For instance, if you notice that maybe one side of your body, an arm or leg, is becoming weak or paralyzed, they need to go to the emergency room because they may be having a stroke. And again, they would need an emergency head CT They may need emergency medical intervention to treat that stroke, because if you get out of a certain time window, you're not eligible for certain medical interventions. So we talked about heart attacks. We talked about sudden onset where you can't really use your arm or leg. Any type of trauma to your head and neck where you lose consciousness. That really should be seen in the emergency room, because they can get emergency CTs of the brain, the spinal cord, etc. Whereas in the urgent care center, we don't have access to emergency CT scans. Shortness of breath where you can't complete a full sentence, that needs to go to the emergency room. Severe bleeding with obvious broken bones, that needs to go to the emergency room. So those are some of the prime examples of when people should, bypass the urgent care center and go to the emergency room.
Yeah, and definitely with heart attacks and strokes, those are things you don't want to mess with. I mean, if you at all feel like you're experiencing those particular things, like, don't even waste a minute. You need to go to the emergency room.
Go to the emergency room or call 911.
Absolutely.
Because the advantage of calling 911 is you get treated by the EMT personnel, and they could actually treat you on the way to the emergency department, as well as perform like maybe an EKG and transmit that information to the doctor in the emergency room, where they can get sort of a heads up of what's coming in.
Gotcha. So what about insurance plans with urgent care? How does that work?
I'm still figuring that out. No, that was my
joke.
Well, it's not a joke if you're on the other end.
Right. No, I mean, you're still figuring it out.
And you're presenting to the urgent care center, trying to figure out what insurance plans they cover. We cover Aetna, Blue Cross, Blue Shield, Cigna, Coventry, etc. But there may be some that we don't cover. And on the screen, I hope they're showing our website or phone number where they can call ahead and sort of ask our urgent care staff, do you cover our insurance plan?
I think when I went for my back problem, I think it was about $70 or something like that, which I know is probably pretty nominal when you compare it to emergency room costs. Talk about the difference between the two.
I think the $7 is probably your copay. So the difference between the emergency department and urgent care center is quite significant. The same injury or illness that's treated in the emergency room can be treated for about a third or even less at urgent care center. Copays may be different, deductibles may be different, etc. And that's not unexpected, because if you remember, emergency departments are staffed to handle true emergencies 24 hours a day. So they have to have several doctors available, specialists, advanced diagnostic testing, many nurses, medical assistants, phlebotomists, etc. So their overhead cost is very, very large compared to an urgent care center. So you can sort of see that extra cost is justified. So hopefully the public realizes, where to go for minor illnesses and injuries as urgent care center versus going to the high cost, high overhead place, the emergency department.
Sure. So when you do go to urgent care and you meet with a doctor, what is the relationship like with the urgent care doctor and a person's primary care physician? Is there a follow-up? Is there communication between the two about what happened with the patient?
Well, first of all, in the day of HIPAA with health information, whatever the patient wants us to do with their records, we're happy to do. If they say, could you please fax or send these medical records to my primary care doctor, we very happily will do that. We always encourage patients to follow up with their primary care doctor, especially for chronic diseases, their diabetes, their hypertension, etc. If they come to the urgent care center and they, let's say they have a procedure done. We drain an abscess, or maybe we suture up a deep laceration, we will do the follow-up in our clinic because most doctors like to tell their patients, we want you to follow up with the doctor who actually did the procedure, because they know what the injury looked like on the day of injury, etc. So those would be about the only injuries we say come back and we'll follow up in our urgent care center. Most other patients, if they have a primary care doctor, we always encourage them to follow up with their primary care doctor.
That makes perfect sense.
Yes.
So what is the wait time like at an urgent care facility?
Well, we are very, very sensitive to patient wait time.
Sure.
We sort of go to general quarters if there's more than two or three charts waiting, and we try to get the patients in fast, triage them, do their vital signs, make sure if they need any advanced testing, we sort of get that going if they're waiting to be put into a clinical exam room. But the waiting time is Usually 20 minutes or less is what we shoot for. We don't always make it
Sure.
because, urgent care is walk-in. So if you have 2 patients walk in one day at a certain time and you have 10 patients walk in the same time the other day, the wait time is going to be a little bit longer. But again, the staff is very sensitive to that. So the wait time in urgent care, if you compare it to the emergency department,
Sure.
which there have been national studies for patient wait time in emergency departments, the average wait time from a Press Ganey survey is about 4 hours.
Wow.
And that's for minor injuries and illness. But people
But they're using the emergency room when they could be using urgent
But they could be using,
care.
but they have to realize the reason they're waiting 4 hours is in the back room of the emergency department. They may have a heart attack, a stroke victim, 2 or
Sure.
3 trauma accidents
Sure.
from a motor vehicle accident, and the staff is devoting their attention to those patients. So they sort of triage the patients where the minor injuries and illness will come in later after maybe a prolonged wait time.
Sure. Well, tell us about the accessibility of urgent care. I mean, do you have more than one location for Baptist, and the hours and those kinds of things?
But our main urgent care center is at the Baptist Medical Park at 9 Mile Road. And Monday through Friday, they're open 7 to 7. And on Saturday, we're open 8 to 3.
Great. Which is perfect because it seems like the worst things ever happen on the weekends. I don't know if that's true, but I feel like usually when I have an issue, it's on the weekend and I can't access a doctor, so it's pretty convenient.
The primary care doctor is not open on the weekend.
Right, exactly.
So now patients are faced, do I go to the urgent care center or do I go to the emergency department?
Sure.
So.
Yeah, that's really great. So if our viewers have want more information about urgent care and how to get to the 9 Mile branch, where could they go?
Well, on the screen is a note at the bottom of the screen about our website and our phone number. They should feel free to call us, and we would give them directions. Call us. We'd give them information about what insurances we will accept. We also have call ahead information. They can call ahead and say, I'm Mary Brown. I have this type of medical problem. I have this type of insurance. I will be there about 1:30 this afternoon. And we will actually pre-register them.
Oh,
and
perfect.
sort of expedite their visit.
That's convenient.
Yes. It's
really
working
convenient.
out very well.
Well, and we have a couple more minutes, so I feel like, there may be some, again, we kind of talked about this a little bit, but misnomers and misunderstandings about what urgent care really is versus emergency. Like, what do you want the public to know about urgent care?
Well, a couple points. Number one, if it's a true emergency, they need to go to the emergency department. I can't tell you how many times in urgent care we'll have somebody come into the front desk and say, my husband, my brother, my mother's in the car, I think they're having a heart attack, can I get a wheelchair and bring them into the urgent care center? So the answer is no. We'll dial 911, or you can go directly to the emergency department, because we don't want to delay the right care at the right time for the right patient. That's very, very important for them, for their own health. So that's the main thing. If it's a true emergency, they should bypass the urgent care center and go directly to the emergency department. The other thing, when patients come in, if they could be ready for the typical medical questions. Every time you come in, we're going to ask you, what medications are you taking? So it'd be better for us to have a name of the medication versus the red pill or the white square pill.
Something blue with some lines on it.
So have their medications ready. Either bring the bottle or bring a list. Their allergies, past medical problems, and past surgeries. Those basic medical questions are so important for every single medical visit.
Sure.
Because as we're trying to diagnose the patient, we want to make sure we don't have any bad interactions with what illnesses they already have or what medications they're already taking.
Sure. Well, this is really great information. And again, I can attest to the benefit of going to urgent care because I personally have experienced the relief that I had, that I was able to get cared for on and off a weird hour, but also just because at the time I didn't have a primary care physician. So I know this information will help a lot of folks, and I really want to thank you again for coming on the show.
Oh, thanks for the invitation.
And again, folks can visit the website, even call ahead, and if they need more information, is it ebaptisthealthcare.org?
Yes, just as it is on the screen.
Great. Well, thank you so much for joining us. And again, like I said, I think this is great information for our viewers, and I'm sure they'll be looking for more information. Thank you so much.
Thanks for the invitation.